Welcome back to Mountain Connections on this wonderful Wednesday morning. Now, we are talking about something very important. Did you know that 37 million Americans live with diabetes, and many of them live with a condition that they're unaware of, where they've got tingling, burning sensations, numbness all in their lower extremities. This is called diabetic nerve pain. So we are super excited today because we have two experts to talk about a brand new campaign to launch awareness around these symptoms. We've got Dr. David Armstrong here with us today and Kathy Sapp, CEO of the American Chronic Pain Association. Thank you so much for joining us this morning.
Total pleasure.
Thank you for having us.
Absolutely. Now, we are just super excited to hear more about this new campaign. So, Dr. David, tell us a little bit more about diabetic nerve pain and what exactly it is.
Yeah, sure. So there's now about maybe 35, 37 million people, just as you said, with diabetes in the United States at least. It's probably an undercount. And of those, about half of folks are going to get what's called neuropathy, and that's basically problems with the nerve. Some can get just a complete loss of pain ultimately, but often before that, several million people at any given time can get really significant diabetic nerve pain. And the thing about this is that it's all over the place. The pain can be like stabbing and needles. Some people describe it as like electricity. Some folks will have horrible pain if their bed sheets touch it at night. And that difficulty really has led to a lot of problems with communication with the doctor, the patient. It often leads to insomnia and depression, poor blood glucose control, and a lot of other complications. But it doesn't have to be that way. And that's why we're coming together.
Now, you're a podiatric surgeon. Tell us what the difficulty is in treating people with these symptoms.
Well, the first and foremost problem here is just knowledge that these problems exist, because they happen so slowly, it just creeps up on you. It's not like a heart attack, even though it is sort of a foot attack, but it happens just so quietly that it just sneaks up on folks. And so so often, because people don't realize how to sort of describe this problem, there's often a delay in treatment, and that delay can lead to all these complications. And that's really why we're coming together to create this problem, where we can bring the problem to the doctor by way of the patient. We're calling it Speak for Your Feet, and that's what Kathy's been doing.
Now, Kathy, tell us a bit more about the campaign and your efforts to bring awareness.
Yes, so today we launched a contest. It's very unique, and it's so patients can share the symptoms of their condition. So what we're asking everyone to do is to create a short memory aid that describes their pain. Dr. Armstrong talked about the numbness, the tingling, the burning. So what we want them to do is to help name that, and this increases the awareness out there of the people living with the disease and may not know that they are. They can enter online at nervepainandme.com/contest.
Now, in addition to the Speak for Your Feet campaign, what are people doing to improve treatment and to improve their lives as they are diagnosed with this condition?
Well, I think, what folks are doing is just understanding this problem earlier is really what it's all about. Early awareness, getting in to see your doctor. And the first thing you can do when you get in to see your doctor, I'll just say, in addition to speaking for your feet, I would say knock your socks off. By doing that, that gives the doctor, him or her, the opportunity to look at your feet. That can begin that kind of dialogue. And the sooner you do that earlier on in the disease, the sooner you can get to effective therapies and really, prevention, because that's really what it's all about.
Wonderful. Now, Dr. David, what would you say are the most important key takeaways? I know you just mentioned to get bring awareness early and to get into your provider, but tell us a little bit more about the most important key takeaway from today.
Yeah, for sure. So this problem is common, it's complicated, it's costly, but it's often quiet. So getting in to see your nurse, getting in to see your doctor, knock your socks off, speak for your feet is really the way forward. And if you do that, you can really make a difference. And we could do that around the country and even around the world.
Now, Kathy, tell us one more time where folks can go to learn more information about the Speak for Your Feet contest.
They can go to nervepainandme.com/contest.
Wonderful. Well, Kathy and Dr. David, it is wonderful to have you both here to make awareness of the Speak for Your Feet contest. I know I will definitely be sharing it with my friends and family to make sure that they are diagnosing and addressing any symptoms they may have. We greatly appreciate you joining our show this morning. Now, we will be right back with some career advice and many more things this wonderful Wednesday morning. Now, stay tuned.